everyone, and welcome to this community briefing on our local ongoing pandemic response efforts. Providing interpretation for us today is Sharon Sinkler. Thank you so much, Sharon, for your services, and thanks to all of you for joining us to learn more about the latest local developments. Since our last briefing in mid-June, our health team has kept a close watch on COVID-19 nationally, regionally, and locally, and the situation is changing. Case numbers and hospitalizations are climbing across most of the country. The highly transmissible Delta variant is spreading rapidly in certain areas of the U.S. and in our region. Science shows that this particular variant spreads more easily and more quickly than other variants, and it's more likely to cause severe disease, especially in those who are unvaccinated. The Delta variant is estimated to be the most prevalent variant in the nation. It's currently surging in pockets of the country with low vaccination rates, including some of our neighboring states, like Missouri. This map shows the level of transmission in counties across the nation. Blue represents low levels of transmission, and red represents high levels. And if you look at the close-up, you can see the close-up on the left of the screen. The state outlined is Missouri, and it's almost entirely red, meaning COVID-19 transmission is high. The Delta variant is now the most frequently identified variant in Nebraska and Lancaster County. Recently, we've seen an increase locally in both cases and hospitalizations, and it appears the Delta variant is a driving factor. Health Director Pat Lopez and her team are actively monitoring the impact of the Delta variant on our community. And Director Lopez now joins us to provide more details on our local situation.
Thank you, Mayor. We are continually analyzing the latest data, and recently we've seen some concerning trends, including an increase in cases and hospitalizations in our area, as the Mayor mentioned. And the Delta variant appears to be a contributing factor. Let me explain why what we're seeing, why we are concerned, and what this means for our community. You can see on the chart that locally we began to see a more consistent decline in new cases at the end of April. The overall drop in the cases continued into May and June. We had experienced a 7-day rolling average in the single digits from May 17th up until July 8th. It is concerning to now see the increase in new cases. You can see the 7-day rolling average now trending back upward on the chart, up from an average of 6 new cases per day on June 1st to 21 cases per day on July 19th. As would be expected, along with the increase in new cases, we have seen the positivity rate increase as well, from 2% at the beginning of June to now 5.3% at the end of last week, ending July 17th. Not as high as near the 10% back in early January, but it is above the 5% threshold that we would like to see this metric stay below. One case can quickly lead to a cluster, and I'd like to share some recent examples. It started when a few children with mild illness were tested and attended a summer day camp for several days. From the day camp, 6 people became ill and tested positive a short time later. These 6 people are reflected in the top row of cases. From the 6 people who were infected at the day camp, 3 of them went to a church service, infecting 3 more people, one whom I'm sad to say passed away. In the center of the graphic, you can see 2 of them also attended a party and infected at least 2 family members, who then infected another member of the household. And on the right, 2 of the people who had been infected at the day camp also infected 3 of their household members. Just one case led to this cluster that resulted in 15 cases so far, ranging from young children to mature adults and leading to 1 death. Some of the people in this cluster were vaccinated, as noted by the green circles, though their symptoms were milder than those who were not vaccinated, noted by the red circles. The 1 person who passed away after being hospitalized was not vaccinated. There is strong evidence that people who are vaccinated will experience milder symptoms if they are infected, and they aren't nearly as likely to require hospitalization or transmit the virus to others. The bottom line is you're more protected when vaccination than without it. Here's a second example. It started when an unvaccinated person came to Lincoln from outside of Nebraska and tested positive for COVID-19. That's that bright red circle in the center. They met their family over the weekend. All family members got infected with COVID-19. Like the previous example, those who were unvaccinated are noted in red, and those who are vaccinated are in green. The family cared for multiple children under the age of 10 from other households, and among them, 3 children tested positive for COVID-19. 2 children were from the same household, and later on, their parents also tested positive for COVID-19. Special testing of the 2 cases showed that they were infected with the Delta variant. This cluster led to 17 cases in Lancaster County. Both of these examples are common scenarios of people becoming infected in group and social settings. They also demonstrate how one person being infected can spread COVID-19 to multiple people at different homes. Now, turning to our hospitalization data, we are also seeing an increase in local hospitalizations again, and that's another cause for concern. As you can see on the chart, we experienced a similar decline in hospitalizations as we did in cases, and that 7-day rolling average dropped to about 9 patients with COVID-19 on June 20th. However, since then, we have seen an increase back up to a rolling average of 30 patients hospitalized at the end of last week on July 17th. Today, we are reporting a total of 40 patients hospitalized, with 8 on ventilators. 25 of those are Lancaster County residents, and 15 are from other communities. We haven't seen this many patients with COVID-19 hospitalized since back in February. Our public health experts have been clear that the pandemic isn't over, and people who are unvaccinated are really at risk. More than 93% of the people hospitalized in Nebraska over the past 4 weeks, ending July 10th, were not fully vaccinated. Today, Dr. Kevin Richmond is joining us. He is a local pulmonologist who's been providing critical care on the front lines during the pandemic. He's going to share with us more about what he's seen related to hospitalizations. Dr. Richmond.
Thank you. It's very sobering to be here. I was here and have been involved in various press conferences over this pandemic, and this has some reminiscence to the one I was at shortly before Thanksgiving, because we are clearly going in the wrong direction, and for a lot of the reasons that Director Lopez has outlined. I think what has happened, obviously, is that we just haven't gotten enough people vaccinated, and the assumption was that by many that maybe it wasn't necessary because cases had been going down, and that's clearly not the case, because we're not even close to a herd immunity type of situation. And so, just to share some of my perspectives, as Director Lopez mentioned, I'm a pulmonary critical care physician here in Lincoln, and our group has been involved from the inpatient, outpatient side of the entire pulmonary care in Lincoln, but also in the surrounding area via tele-ICU and so forth. And what I can tell you clearly that most have heard is that our patients that are getting admitted are largely unvaccinated. I got some rough data here over the past few months, and just like you hear nationally, it's 90+% of the patients who are admitted with COVID-19 are unvaccinated. Personally, the ones I have been involved with that have been vaccinated but got ill enough to require hospitalizations have not been nearly as ill as those who have been vaccinated. And so it's unquestionable that the vaccinations are highly effective at preventing disease. And so the data with that is borne out in multiple ways. And then as it relates to that question, what we're seeing then is that these patients, and I just came from the hospital, all of my patients that are critically ill in the ICU right now are unvaccinated. And it's disheartening for our entire team to see this was completely preventable when you look at the data. We're going to have some vaccine breakthroughs. Rarely will we have some vaccine breakthroughs that lead to ICU level care and unfortunately death, but that's going to be an exception much more than the rule. And so I see it in the faces of my colleagues that it's so difficult. And like I was telling an individual that I just saw today, unvaccinated, admitted with COVID from outside Lancaster County, unfortunately, the treatments we have for COVID-19 once somebody is hospitalized are not nearly as effective as the vaccinations are at preventing disease and this degree of illness. We don't have therapeutics. Certainly the monoclonal antibodies have been proven to be highly effective, but that's pre-hospitalization and still is a tool that needs to be utilized. So I can't stress strongly enough, what I kind of, the analogy I give, there's a level of fatigue and post-traumatic stress that still is existing from what we went through in the fall and the winter. And I was kind of thinking about this, and again, apologize for if this is over dramatic, but I think it's worthwhile mentioning. In some ways, it would be like if we asked those soldiers on D-Day to do what they did, go through all of what they did, and come through that and be successful, and then turn around and have to do it again. And that's what I'm afraid of as we get here with this trajectory, as we get into the fall and winter, if we don't have improvements in our vaccinations. And so my plea out there is that people encourage family members, loved ones to get vaccinations. I would really love to see our outpatient primary care and other providers that haven't necessarily been in the hospital going through this to encourage vaccinations. Please take the time to talk to your patients about vaccinations. I will tell you that I have absolute confidence in the safety. I've already talked about the efficacy, but absolute confidence in the safety for vaccinations. And there are some rare side effects with vaccinations that happen early. I hear from patients about their uncertainty about the long-term vaccinations. If you look at the history of vaccinations, the long-term side effects from vaccinations don't exist. The things we see occur in the short period of time, usually within 6 weeks, and that's what we're seeing with this vaccination. I'm going on 8 months since my vaccination, and all of my colleagues are in the same boat. And so I just have absolute faith in its safety. The efficacy is proven. Please, let's not ruin the gains further from where they are. We have an opportunity here, and the buzzword right now is Delta. But I'm telling you, this virus, as long as it's continued to allow to circulate, there will be others. Lambda's on the horizon. We'll get down to Zeta if we don't absolutely crush this by getting people immune. This thing's going to continue to roll its dice with mutations. And unfortunately, the thing that we're all worried about is there will be a mutation that evades the vaccinations or natural immunity even more so than what we see with Delta. So let's take this opportunity. Let's get on top of this. Let's encourage everybody to get vaccinated. Ask questions if you have uncertainty, but go to reliable sources because it's definitely not too late. But I certainly am my entire team is very worried about what we're going to see here in the fall, in the winter, if we don't break this chain. So thank you.
Thank you, Dr. Richmond. The Delta variant, as Dr. Richmond said, is really now the most frequently identified variant in our county. And it will keep spreading if it has the opportunity. And we will see other variants come into play as well. We continue to urge every eligible adult and child to get vaccinated now if they haven't already. Vaccination, as Dr. Richmond said, is the best protection we have against the virus and the variants. Vaccination helps prevent severe illness, reduces hospitalizations, and slows further spread in our community. If you've had COVID-19, the latest research shows you may not be protected against the Delta variant. So I also want to stress the importance of vaccination for those who have previously had the disease. Children not yet eligible for vaccine or others who may not be able to get vaccinated are more susceptible. We can help protect them by getting vaccinated. As we seek to protect our community's children who are not yet old enough to get vaccinated, it's worth noting that the beginning of our school year isn't that far away. The more students and teachers who are eligible roll up their sleeves and get vaccinated, the more we can help minimize the potential impact of the virus and its variants on people in our local educational institutions. We partnered with local pediatric practices also so they can offer vaccine to their patients on site. This gives parents an opportunity to talk to their child's healthcare provider about the vaccine and get answers to any questions they may have. Keep in mind, it takes at least 5 weeks for a person to be fully vaccinated with 2 doses. So it's important to start the process now to be close to fully vaccinated by the time school starts. Every person who is vaccinated creates additional protection for our community and puts us another step closer to our goal of 75% of our population 16 years and older fully vaccinated. Currently, more than 67% of this population is fully vaccinated. To help reach our goal, we are providing morning vaccination clinics at the health department on Monday and Fridays, and late afternoon clinics on Wednesdays. Walk-ins are always welcome at any time, 8 to 4:30, Monday through Friday. Our people can schedule an appointment at covid19.lincoln.ne.gov or by calling us at 402-441-8006. Additional clinic locations are added frequently. Residents age 12 and older are eligible to receive the vaccine, and the vaccination is free. Residents can also find a local pharmacy offering vaccinations at vaccines.gov or by texting their zip code to 438-829. COVID vaccination is the best protection, but there are other ways to help slow the spread of the Delta variant and protect ourselves, our loved ones, and our community. As we mentioned previously, masks are recommended for unvaccinated residents at indoor gatherings. In areas with high numbers of COVID-19 cases, they should also consider wearing a mask in crowded outdoor settings and for activities that have close contact with others who aren't fully vaccinated. If you are fully vaccinated and have an underlying health condition or taking medications that weaken your immune system, we encourage you to keep taking steps to protect yourself, like wearing a mask and watching your distance. Talk to your healthcare provider about steps to take to manage your health and risks. If you're traveling this summer, be aware of current COVID-19 hotspots, as the mayor mentioned. Continue to monitor your health and be on the alert for symptoms like fever, cough, shortness of breath, and other symptoms of COVID-19. Whether you're fully vaccinated or unvaccinated, if you start experiencing COVID-19 symptoms, separate yourself from others and get tested. In reviewing all of our indicators, the risk dial will remain in green this week, but it is on the verge of moving to yellow. Our hope is that the increases we're seeing in cases and hospitalizations will level off and then decline. But if this concerning trend continues, we will make adjustments to our data-driven approach as needed. Together as a community, we have been committed to protecting the health and safety of others, our family, friends, and neighbors, and we started to see those benefits. We've come so far, and we need to keep going, continue to increase the vaccination rate in our community, and be mindful of our actions and how they could affect ourselves and others. By providing frequent information related to our community situation, we can make informed decisions to protect our health. We still have work to do to this end in order to end the pandemic. Let's do it together.
Thank you, Director Lopez and Dr. Richmouth. For those who are still unvaccinated, the Delta variant presents a particularly painful battle for our city. These hospitalizations, deaths, and increasing case counts are preventable. We have vaccines available for anyone who wants to be part of the solution. And as you've heard here today, the vaccines work, they're safe, they're effective, and they save lives. As we focus on preventing illness and saving lives, we're reaching out to make sure that everyone has the knowledge and access they need to protect themselves and one another. And I'm pleased to announce that the City of Lincoln has received a $3.5 million grant from the U.S. Department of Health and Human Services, Office of Minority Health. The funding will be used to build upon our existing response efforts and help communities disproportionately impacted by the pandemic access COVID-19 related information and COVID-19 vaccinations. Lincoln is one of 73 local governments participating in this new 2-year Advancing Health Literacy to Enhance Equitable Community Responses to COVID-19 initiative. This grant is critical in helping our vulnerable residents find, understand, and use information and services to help make health-related decisions for themselves and their families. COVID-19 information, like preventive measures, vaccines, and clinic locations, should reach all members of the community in a way that they are able to understand and act on that information to help protect themselves, their families, and our community. Throughout the pandemic, the health department and numerous partners have worked together to reach diverse and vulnerable populations and help ensure that COVID-19 testing and vaccines are equitably accessible. This grant provides the opportunity to further expand our efforts and better serve our entire community. And as part of this initiative, health literacy associates will be hired and trained. They will work with diverse populations in Lancaster County and in coordination with our community and cultural centers. Part of this effort will include developing additional education and communication resources for populations disproportionately affected by COVID-19, with the goal of increasing vaccination and testing. The grant strategy will also strengthen our collaborations and allow us to build capacity among our community cultural centers to expand culturally appropriate health education in the community. The health department has also partnered with the Nebraska Association of Local Health Directors to assist in the coordination of this initiative. The association has significant expertise in health literacy programs and has led health literacy efforts with local health departments statewide. This has been a team effort, and we appreciate the support that our partners and this grant will afford our city. And with that, we'd like to open things up to the media to answer any questions you may have.
I've got a question or two for Pat.
Hi.
Hi. So, can you give me an idea of what the age breakdown is on cases recently? I mean, are the cases higher in the younger age groups?
The number is much higher in 50 and younger. We are seeing some youth under 16. Our concern with the hospitalizations has been that they're primarily a younger group of individuals, where we were seeing older adults previously, but a lot of the people we're seeing are under 60. Our largest area where we still are trying to encourage vaccination, especially, is the 16 to 24-year-olds. I think about 44% of them have initiated vaccinations, and maybe 37% are fully vaccinated, from what I can recall right off the top of my head. So really, we're still really encouraging those 50 and younger to get vaccinated.
And then on hospitalizations, I've noticed recently hospitalizations in Lincoln have been higher. I mean, total numbers are higher than they are now. I think Omaha, Douglas County reported 29 yesterday. We're up to 40 today. Do you have any idea why that is? I mean, it seems like there are quite a few are in Lancaster County.
Quite a few are Lancaster County, but only 2 of the people on vents are from Lancaster County. There's a large outbreak going on in a community close by us, and many of the hospitals, many of those patients are coming from that area.
Is that Fairbury?
No.
No.
I have a question. At what point can we see restrictions come back, and is that being discussed at this point?
We're not discussing restrictions at this point. We'll still be looking at the data as we make those decisions going forward. Certainly, we're going to be encouraging, we'll see where we go. As I said, we're on the cusp of going to yellow right now again.
LA County in California just issued another mask mandate for everyone, including vaccinated people. Is that something where we could see that happen here in Lincoln at any point?
I would never say at any point, but I can be very honest in saying that's not something we're considering at this point. But as the variant changes and more people are impacted, and I think Dr. Richma made a good point. I was visiting with one of the hospitals this morning, and the staff are already becoming very concerned and wary about the increase in patients and what's needed. And not everybody's fully recovered in the workforce from the stress they've been under. So right now, we're not saying that, but we're going to go forward as we always have based on the data in our community, and we're going to make decisions from there.
We've seen kind of a surge in cases here just recently.
Yes.
100 from, Saturday to Monday, I think.
Mm-hmm.
Do you attribute that to anything? I mean, last year, for instance, sort of post 4th of July, we had kind of a surge, and it leveled out, and then when students came back, it took off. I mean, are you worried about that same kind of situation here? Maybe not on the same scale, but...
Yes, we are concerned about that. And, we've continued during this entire time, like we're meeting regularly with all the school administrators, and with higher education, we have plans in place for testing and vaccinations. As we go forward, we are seeing some from the 4th of July, and we've been analyzing all the data to look at if we have additional clusters. And we shared some of the clusters that we're seeing and how people are infected. But we do know that family members more and more in the groupings that we're seeing are being impacted.
Vaccinations have decreased significantly in the recent weeks. Is there any reason to think that that will change? And what happens if it doesn't change?
Well, I think if it doesn't change, I can tell you what's happening. We're going to have more cases of COVID and more variant spread, and we're going to continue in that way. If you think about it, some of you are probably too young, but when the polio vaccine became available, we all went and got the polio vaccine. A different time, different information. But the one thing the polio vaccine did was it eradicated polio. That's what we can do with the vaccination for COVID. By taking it, we can eradicate it so that it doesn't keep splintering often and we have more variants. We're still working in certain quadrants of the city where we know that some people have not been vaccinated to make it more accessible. And instead of moving by large percentages, you've seen, as you mentioned, we're moving by tenths, and we're going to continue that effort. We've had some areas where people have been reluctant and now are coming forward. So we're just going to continue providing education and reaching out.
I noticed vaccinations actually did tick up last week. So
Yeah.
Is there any specific, was it young people? Was it older people who had held on?
It was across the age span. And one thing we do hear from people is, and you probably even saw the article in the paper from the gentleman from Richardson County, he just hadn't got around to it, and he was doing other things. That is something that we actually do hear from people. So now is the time to get vaccinated.
Is there any fear with the influx of people coming in for the rodeo? It's about 30,000. One of the cases you had, the cluster, was somebody who had come from out of state. Is there any fear that that clustering will happen just from the influx of people that we don't have vaccine information on or don't know the rate of vaccination within that group?
I think that always is a fear, and we have many events coming here and we're monitoring to see what's going to happen. That's certainly something that we're watching closely right now.
I have a question for the doctor, if I
Yeah.
may. So please correct me if I'm wrong at any point during this question. So we know that transmission equals mutation, that's correct?
Well, replication equals mutation.
And how it replicates via transmission, and when it infects somebody, correct?
Yeah, when it's in our body, it's replicating, and so with each replication, that's where mutations occur.
So my question is, if people who are vaccinated are still ending up getting infected with COVID-19, is there still a chance for mutations to happen even if people are vaccinated?
Correct. I mean, anytime a virus can replicate, it can mutate, but the difference clearly the data shows is that the level of viral load in even vaccinated patients who get sick or get the virus is dramatically lower. I mean, that's been proven in multiple studies. So, to answer your question, yeah, it's still possible, but the likelihood goes down. It's much higher in an unvaccinated person where you have higher viral loads. And just, I thought maybe I'd piggyback on what Director Lopez said. The hospitalizations that we've seen clearly have shifted to a younger group. I mean, I just looked and, 30-40% of our patients are less than 50. And so it is definitely impacting younger, and they're coming in sicker. So there's definitely something to the virulence of this. Yeah.
I have another question for Pat. LPS sort of solidified and sent out that back to school plan. They work very closely with you. They said they'd be reviewing it about every week or so. Is there any indication if we keep trending in the wrong direction into yellow before school starts that would change, or that there would be any more restrictions put in place before school would start?
I think, as Dr. Joel has said, and we've said to Dr. Joel and their group, and actually to all the school administrators, we're going to base our information on the current knowledge, and there is a chance based on what's happening in the community, what we're going to recommend in 2 weeks from now could be different than what we've recommended now. And they're prepared for that as well.
We have a question on the chat from Dale at KFR News. He says, has any more information been received about a third shot or some type of booster or additional protection?
Great question, Dale. Thank you. Right now, the third shot is on hold for the booster. Many of you probably heard that. That still has to go back to the FDA, and we're waiting for more information on that. And we're also waiting for information. It's looking like it might be towards winter before we get more information on when we can vaccinate children under 12.
Pat, we sort of talked about figures of percentages of people who are hospitalized who had what they call breakthrough infections. Do you guys have any data just on overall cases? How many of those cases are among people who have been fully vaccinated?
I can't tell you that off the top of my head, but I can tell you that we check all the cases that come in for who's vaccinated and who's not. So let me give you an example. On the 44 cases that we had, this is still really right on the top of my head, Saturday, 6 of those individuals were vaccinated out of 44. So just to give you an idea. And what we've seen is this transmission, while somebody might be vaccinated, as Dr. Richmond said, those individuals that have been vaccinated, primarily we found they have the Delta variant, and that's what has come through. They are rarely very ill, but those that are unvaccinated do become ill, and then especially children. That's why we're seeing more things, because these children are ill enough that they're going into the physician and they're getting tested. The largest percentage of our cases, I can't tell you what percent, but the largest percentage are unvaccinated individuals.
I do have another question for the doctor. Sure. So, at the hospital, you said you've seen people who are definitely more that are unvaccinated. Do you have any stories of people that are unvaccinated that when they came out of the hospital, you've heard stories of them saying, well, I wish I was vaccinated? Can you elaborate on anything like that?
Well, definitely. The case that sticks with me is the one that Director Lopez just mentioned about the farmer from Richardson County. He, while I was seeing him, he was very remorseful. And again, although we get frustrated, oh, why didn't you get your vaccine? He explained he was farming and his whole family had COVID in the fall and he didn't get it. And so, just kind of got lulled into thinking I'll get it sometime later. He was very, and he's the one who said, I really wish I could get my message out about my perspective on how much I wish I could get vaccinated. And I can tell you, just right here this week, every patient that wasn't on a ventilator that I was seeing with COVID unequivocally makes comments, I wish I'd have done it, I wish I'd have done it. And so, and again, my heart breaks for him, but I hope that message gets out. There's not a person who got COVID and hospitalized that I've had that said, well, I'm sure glad I didn't get vaccinated. So I think it's really important. And to go to the question over here regarding hospitalizations, when I polled 93% of our patients that got hospitalized between June 1st and July 19th were unvaccinated. So it goes, same thing with community cases and hospitalizations, even more so.
Any further questions from the media? If not, we thank you for tuning in. We are continuing to monitor the situation. Please spread the word, but not the disease. The vaccines are safe and effective, and they save lives. If you haven't gotten your vaccine yet, please do. It'll help yourself, your neighbors, and our community as a whole. Thank you.